So what specifically are now the security challenges here? Well, for one thing, the data which is held within the hospital or private office IT systems have actually the same attractiveness to hackers as data in a bank or a retail store or a credit card company. But the differentiator is that at least today, healthcare IT systems are actually easier to penetrate. So we, from the Symantec side, where we watch, let's call it market trends in the business of hacking, we really see a shift in hackers moving away from the amateur who was in it for sensationalism to the professional hacker who is in it for the financial aspect of the business, but also away from the financial institutions, which get more and more difficult to penetrate, towards healthcare. And that has led to the fact that actually today, healthcare is in the number 3 spot in terms of number of data breaches after government and academia, but ahead of banking and retail. So I think that's a very worrisome trend we need to deal with. So what really does the threat landscape look like if you think about the ability to penetrate? Well, Symantec offers on a regular basis a security threat report. And the last report we issued covered the 12-month period from mid-2007 to mid-2008. And we saw in that period 2 times as many new viruses being released into the wild as in the entire history of computing. So the threat is really growing exponentially, and it's not going to stop anytime soon. And on top of that, those threats are more sophisticated. Let's look at the very well published Configure worm. Well, it had some very worrisome characteristics. It's self-distributing, it's morphing, meaning it can change what it looks like, and it has the ability to receive remote instructions. So take the healthcare equivalent of a virus which infects humans, and all you know about the virus is that it spreads, and at some point it's going to get instructions on how to behave, but you don't know what those instructions are. That is what we're looking at right now in the security world, and especially in healthcare. So the risk exposure is really changing significantly because of all those trends. The risk is not just limited to the individual weak spot in the system which could get infected or penetrated or breached. No, it's the other way around now, that the single weak spot in the system becomes a risk to the entire larger system. So from the provider side, what does it mean for you? What can you do about it? And there was actually an event here yesterday I attended. There was a very interesting comment made that 90% of all security problems which exist today, or which security events which occur today, can be mitigated by known fixes. So meaning your inventory control of your IT system, and that includes medical devices with embedded software, is the first key step. Know what you have, know what versions you're running, what patch level, and keep it up to date.